Hello, it's Dr. Rhonda Johnson, and today is Friday, April 22nd, 2022. Today I'm going to be talking about masks. It's hard to believe we're still talking about masks 3 years into this pandemic. Now, this is my common sense revisit for mask wearing. It is not the CDC guidelines. I want to just say that up front. So just remember, folks, mask is a tool in your toolbox for preventing the spread of COVID, any variant of COVID, but especially this Omicron BA.2 and its sublineages, because they're dominant right now and they're far more contagious than previous strains of this virus. Now, I think it's important to remember that any mask wearing is better than no mask wearing if it is your goal to not get infected from COVID. And the best mask is the one that you will wear consistently and correctly. So reminder, who's protected by wearing a mask? Well, when you wear a mask, you're protecting yourself. Why? Because you may be around others who have the virus and don't know it. And the person who has the virus, that's infected with the virus, that is wearing a mask, helps protect others from getting their infection, so it can be doubly protective. Less virus means less virus in the air, less people get infected. Now, the highest quality masks in terms of filtration from these aerosol viruses are N95, a KN95, or KF94. Again, these work to prevent airborne transmission of COVID. Now, masks should not be worn by children under 2, anybody who has trouble breathing, or people who are unable to remove their own masks without assistance. Someone who's incapacitated, unconscious, etc. Now, wearing a mask doesn't get you to zero risk from COVID. Other variables come into play, such as how close you physically are to somebody with the virus, how much time you're exposed to them, and how well your space is ventilated. Now, can you reuse a filtration mask such as an N95, KN95, or KF94? Yes. But the experts say you should store it in a brown paper bag, preferably in a dry spot like a sunny window, for at least 3 days, because the coronavirus can persist on surfaces for at least 72 hours. Can you disinfect your disposable mask? Folks, getting the mask wet with soap or water can damage the material, so don't disinfect it. Don't use bleach, alcohol, spray Lysol on your mask either, because you may be rebreathing disinfectant that stays on the mask, and that's not healthy for you. When you remove your mask, touch only the elastics that go behind your ear and wash these hands afterward. When should you throw your mask away? Well, if it gets really wet, or if you're out in a crowded area, with lots of people. Use your common sense, folks. If you think you should throw it away, throw it away. That's my message today. As always, my views are my own. Stay safe.